Hollister Wound Care, the company that is advancing the science and practice of wound management, is proud to offer a full line of highly absorbent, antimicrobial calcium alginate silver dressings for advanced wound care. Due to the composition of calcium sodium alginate, Restore Calcium Alginate Dressings provide superior tensile wet strength, which allows the dressing to be removed from the wound in one piece, which leaves less residue in the wound bed, thereby reducing the need for repeated irrigation that may damage fragile granulating tissue. Restore Calcium Alginate Dressings with silver absorb 43% more exudate versus competitive silver hydrofiber products and don't shrink when coming into contact with exudate, maintaining their size and continuous contact with the wound bed. Restore Calcium Alginate Dressing with silver is an antimicrobial dressing composed of calcium alginate, CMC, and a silver ionic complex. Restore Calcium Alginate antimicrobial dressings are effective against a broad spectrum of microorganisms, including MRSA, VRE, Pseudomonas, and Candida. Odor reduction resulting from the antibacterial effect in the dressing is an added benefit, and the dressing is also an effective barrier to bacterial penetration. The benefits of using Restore Calcium Alginate Dressings with silver include high absorbency, which uniformly absorbs exudate and protects the peri-wound skin. Restore Calcium Alginate silver dressings form a conformable protective gel upon contact with exudate that maintains a moist wound environment. The silver ionic complex of the Restore Calcium Alginate dressing has been shown to be an effective antimicrobial agent against MRSA and VRE. The dressings have a superior wet strength that allows for intact one-piece removal, which reduces residue in the wound bed, reducing the need for repeated irrigation that may damage new tissue. As the product contains alginate, it may assist in supporting the control of minor bleeding. Dressing change frequency will depend on the clinical condition of the wound and the level of exudate. Restore Calcium Alginate silver dressings are indicated for use on moderate to heavily exuding, partial to full thickness wounds, including pressure ulcers, leg ulcers, diabetic foot ulcers, partial thickness burns, dermabrasions, traumatic wounds, and postoperative wounds. The dressings can also be used under compression bandages. These dressings are available in a variety of sizes to meet your treatment needs. Begin by assembling the materials you will need, including a wound cleanser or sterile saline, the Restore Calcium Alginate dressings with silver, and an appropriate secondary dressing such as a fixation dressing, gauze or gauze wrap. Select the appropriate dressing size to ensure it covers the wound. Note that the Restore Calcium Alginate dressing with silver is highly conformable, making it an ideal dressing for a wide variety of wound locations. For this example, we will apply Restore Calcium Alginate dressing with silver to a large wound with undermining. First, cleanse the wound according to your facility's established procedures. Next, loosely pack the undermining with the Restore Calcium Alginate with silver rope dressing. The rope dressing can be loosely packed into any tunneling as well. When the undermining packing is complete, loosely apply a secondary dressing of calcium alginate with silver, being sure to cover the entire wound bed. It is fine if the dressing overlaps the edges of the wound onto surrounding skin. Lastly, apply and secure an appropriate non-occlusive fixation dressing, in this case, a bordered foam dressing. The high absorbency of Restore Calcium Alginate silver dressings may reduce the need for repeated dressing changes, which helps minimize disruption to the wound bed due to frequent dressing changes. Calcium alginate dressing with silver is suitable for use under medical supervision on wounds that are critically colonized. Dressings need to be changed as often as necessary, depending upon the clinical condition of the wound and the level of exudate. Initially, it may be necessary to change the dressing every 24 hours. Restore Calcium Alginate dressings with silver are contraindicated for third-degree burns, surgical implantation, and for individuals who have a known sensitivity to silver or alginates. They are also contraindicated for use to control heavy bleeding or for direct application on dry or lightly exuding wounds. The dressing may adhere to a dry or very lightly exuding wound. If that occurs, moisten the dressing with sterile saline to help with the removal. See instructions for use for complete details. Simple, effective, versatile. Impact your clinical outcomes as well as patient comfort with Hollister Wound Care's highly absorptive Restore Calcium Alginate Silver Dressings.